We've got Joshua Arterbury with us, the co-founder and president of Heartstrong Sleep and CBD. We're going to talk a little sleep apnea for a few minutes. We were all tested. OB is in studio again. Ryan Brauninger. I'm here. We got some others on staff that have been doing the test. And I guess, Josh, can you start things off with reminding our audience what is considered sleep apnea?
So sleep apnea is OSA, obstructive sleep apnea, which just means that there's some obstruction preventing you from breathing while you sleep, right? So typically it's either a narrow passage, narrow throat, large neck, or just naturally a narrow passage. Very typically, when we sleep on our back or on our side, soft palate falls back, tongue falls back, prevents breathing. And so that's what we measure while we're sleeping. There's some other apnea events that we talk about, but the main one is OSA. Okay,
all right. And OB told me, yeah, I probably got it. Bronny, you think you have it?
1,000%. I'm asthmatic and I'm a big dude.
Yeah.
All right. So for everybody who's
sexy,
very sexy.
Thank you.
Actually, I take that
new
back.
shirt. Thank you.
Is that salmon?
I don't know. Peach.
Looks like a whole school of salmon.
All right, listen here.
We'll try to keep it. I'll try to, you know how I am.
Yeah, well, Billy's listening right now. He's like, this segment's getting off.
Right.
All right. So, hey now. So let's talk. By the way, people who I might have it. I've been saying for years. I had my nose not fixed, but I had surgery done to kind of fix my breathing pattern. I still don't think I'm getting great sleep, and some of that is not getting enough hours, but some of it I think is my quality of sleep. So I guess you want to start off with...
yeah, we'll start off because this table is actually a perfect example of the different body sizes, different body types, different sleeping patterns, and different levels of OSA. Okay. So we'll start with you three. We tested a few more, but those other two didn't really have sleep apnea. Oh. But each one of you have sleep apnea to different degrees, so it couldn't have worked out more perfectly for the segment. So, but let's start with the worst. Besides myself, because your numbers are very similar to mine when I don't sleep on my CPAP. Let me get to my notes here real quick, Bronny. So you told me you had horrible sleep, but you didn't think you slept much.
I didn't think I slept at all. I woke up, had indigestion at about 1 o'clock, and then just kind of tossed and turned and couldn't ever really. I was like, man, if this was pass fail, I definitely failed because I don't sleep particularly well. Yeah. But I slept terrible that night. I was like, I couldn't have picked a worse night to try to run this test.
It's a typical night though, probably. The body does an amazing job of adapting to poor sleep, which is why we can go so long having OSA. We recorded 7 hours and 21 minutes, and we got 6 hours and 54 minutes of sleep.
Wow,
right, that's a great percentage. Goodness,
great. Yeah.
Well, I didn't start the test until I felt like I was really close to going to sleep.
Yeah, and the sleep you got was pretty poor. So the thing that is glaring to me, the thing that I look at, and again, I'm not a physician, but I do have OSA. I've had it for my entire life. I've been treating it for over 15 years, seen hundreds, maybe thousands of sleep studies. Is what's happening when with OSA is when you literally stop breathing, right? And the index is measured by how many times you do that per hour, and then the different levels of that. So, but what happens when you stop breathing for 3, 4, 5, 7 seconds at a time per hour, multiple times per hour, your heart's having to pump so much harder to get oxygen to your vital organs, to your brain, your lungs. And it does a lot of damage to your heart, right? And so then what comes of that? Potential for stroke, diabetes, heart attack, because it's just having to pump so hard over a long period of time, right? So it's never too late to start. But you got desaturation, which is when your blood gas drops below 90%, which is dangerous. Right, that means blood's just not getting to your organs. So you had 2 hours of desaturation, under 90, and as low as 72. So part of this is meant to scare us, right? Like these are big boy numbers. Like we have to talk about it because so many of your listeners suffer from it. But 72 desaturation is pretty low. So like you had 380 desaturation events, meaning your blood gas dropped below 90 380 times.
Wow.
For a total of 2 hours during your sleep. So people that drop below 90 just in normal everyday life are on oxygen. You see them carrying it around. I'm the same way. I saw those numbers and I'm like, I almost had the heart attack that I was working on in my sleep. I don't want to get through all the numbers, but it's big. And then the snoring level, I don't know if people told you snore loud.
Oh, my fiance every day.
Yeah, right?
Yeah.
You snore. It's really off the chart on this machine. And each of you hit above 70, which is like louder than a vacuum cleaner or a hair dryer. So imagine that noise in your partner's face.
Oh, yeah.
Snoring. It's loud.
Yeah, usually my obstruction is my wife's putting the pillow over my face to try to.
You're right. Yeah, that's another thing. Probably a different segment. But we talk about bruised ribs, like we cure bruised ribs, because that's usually the elbow into the ribs is what happens. So, again, I want to. The physician hasn't looked at these numbers, but I want our physician to look at the numbers for you, and most likely she'll recommend CPAP for you.
Cool.
And probably no other treatment. You're a candidate. Congratulations.
Yeah, can we move on? I feel like I just got buried.
Right.
I knew I was going to have issues. Yeah.
So, well, I'm glad this happened. I mean, this is a good impetus for you and for a lot of folks, because the day I started CPAP, it changed my life.
Yeah.
I sleep like a baby. Last night I got in at 1:50, I think, from my flight. Woke up this morning at 5:30. So I only got 4 hours of sleep, but the sleep I got was perfect.
Quality sleep. Yeah.
Very quality. Okay. Olin, we recorded 5 hours and 57 minutes for you. Most of that was sleep. You might have had a little bit less than an hour of wakefulness. You did desaturate, but not quite as often, not as measurable in terms of minutes. But you had, I think, 22 desaturation events, but as low as 88. So, when you drop below really 92, we want to stay above 92 to keep our blood gas good. So you had some desaturations also, very high snoring. You snored a lot more, and we can get into these the details offline, and we can talk about the positions that you sleep in. But anybody who's sleeping on their stomach or right side is typically going to snore or desaturate more. Supine on the back is where we really want to sleep most of our time, or our left side. It's just the way it works. So, yeah. So
I don't think about it. I just sleep.
Yeah, and that's the thing. You have these disturbances, whatever they are, called respiratory disturbances. Some of them are apneas and hypopneas, which are obstructive, and some of them could be sinuses or other outside factors, right? But overall, you have mild to moderate sleep apnea. On the scale, 5 to 15 is mild. 15 is kind of the moderate line, and above 15 is moderate to severe. 72, you're at around a 12, but still a candidate for CPAP, possibly an oral appliance. But CPAP's the gold standard.
Yep.
Oral appliance is definitely for mild. The dentist might tell you otherwise, but CPAP's the gold standard. So I think you would do well with CPAP.
There we go.
So again, the candidates talk to the physician.
Yeah.
Now, I would have to ask you what kind of, because I had a CPAP.
Right.
And what, if any, advances have been made? Because my problem was when I'd put on the mask, the air would leak out and sound like you're trying to sleep with a tire,
it's like a hissing, right?
Well, and then I went to the things that went in your nose, the I guess what they call pillows or whatever, and they kept popping out. Yeah. So finally I got so frustrated because I was saying, well, I was sleeping more before that.
So the technology in the masks side is tremendous.
Okay.
And they come out with new masks every 2 to 3 years, but we're in the best possible time. Most people fail on CPAP because of the mask. It doesn't fit right. They sleep in a sleep lab where they're just trying to get full coverage. They put you on a full face mask, which is probably the most invasive, least comfortable mask. But we have digital technology now that can fit your face.
Okay.
And put you in the perfect mask. And the other thing too is people might be in the perfect mask, but they forget that the cushions degrade, and they won't change their cushions, which are supposed to be changed every 30 to 40 days. And insurance pays for that. But people just think we've seen some crazy masks like duct tape and fishing line held together. So, because it degrades. So you might have had the right mask that just degraded over time. And once that happens, therapy doesn't work because you leak. And then we got a leaker. Leaker. So you were actually third, Nuńo.
Okay.
But you're confusing to me.
Okay.
In several ways. So you have mild sleep apnea.
Yeah.
Okay. Your numbers came in right around 4 events per hour. You desaturated, but the thing that separates you from certainly me and a lot of other folks is you're fit, super fit. So typically what happens in desaturation, your heart's having to pump harder and try harder, right? Well, if your heart's in really good shape, it doesn't have to pump quite as hard. So when your desaturation happens versus like mine, you may desaturate, but your heart rate stays relatively good,
right?
Like in the 70s. But your resting heart rate 45. While you're sleeping could be 45, 38. Right. Excellent, right? And then you also have a lot of snoring events, though.
Okay.
So that's something we could look at. But overall, it's not too bad, but you're having a lot of events. So for someone like you, where you're mild, you could definitely benefit from therapy, but I want to see more numbers. So we need to do an extended test on you.
Okay.
So the watch that y'all used is a one-night disposable, and then we have a non-disposable that we can get up to 5 nights on.
Okay.
And I think I'd like to put you on that. So
does it say how many times I wake up? Because I think, because I've been saying it for years, I am not getting quality sleep at night. If I get 8 hours, I still feel tired. If I get 6 hours, I feel tired. Like it.
Yeah. So those we can get into the wake versus sleep. Mm-hmm. And it's pretty good. It's not as bad as you probably think it is, but it's disruptive, right? And it's spread out. It doesn't just happen once. It happens, 4 to 5 times per hour.
Right.
Right. Now, me and him, 70 times per hour.
That's
like
a big difference,
nonstop, right? Him, 10. It's still a lot. But 4 is a lot less, but it's still 4 times an hour you're having an event that potentially wake you up. So there's lots of different things we can work on with that. Okay. But definitely a candidate. I think you would benefit from CPAP.
So does it, I don't know if your study can tell you, is it more here or is it potentially the tongue? How do you figure that part of it?
Here.
Well, probably. I've been dealing with my whole life, though.
It is. Some of it is obstructive, right? Which are the real numbers, right? That shows us we absolutely know how many times you're waking up and typically why from an obstruction. And that could be sleep position. But then there's other things we talk about, the sleep hygiene, which I know you're
I'm good about that, yeah.
Yeah, you concentrate on. And then there's some other things that we maybe don't know. That we would just have to explore more and get more data, really.
Right.
One night is for us 3 is pretty easy. One night for you may be different. And so you may have more severe nights. Like you told me last week, like your wife saw you gasping. Middle of the night. Well, that's a telltale sign, right? That's called a witnessed apnea. That's the number one thing that insurance pays for. They're like, okay, that's serious. Somebody's seen this happen. So we know that's happening, which is, and we see it in the numbers. It's just not happening as much as somebody else at the table, but it's still disruptive, like I said.
And allergies can play a part in this.
Absolutely.
Correct? Yeah.
Allergies, even when you're on therapy, if your nose is stopped up or if your nose is running, and or if you drank or have a deviated septum, which most of us do, there's just so many factors that can affect it.
How about eating?
Eating, absolutely. Yeah. Typically, which is harder for some of us than others.
Right.
We don't want to eat like within 2 hours of sleep, right? And you want to drink enough water to get you through the night, but also not that you get up because one of the symptoms is like for us, I would get up, 7 to 10 times a night to go to the bathroom,
right?
Which is also disruptive, because your body's not like when you get into REM and deep sleep, your body kind of shuts everything down, and that you can, your body's like, all right, you can make it 7 hours without getting up to go pee. But if you're not getting into deep sleep or REM, you're aware of it, so you listen to your body to get up.
And caffeine throughout the day, of course, can also play a role in all that.
Yeah, caffeine's just, for most people, is just, it's horrible for sleep. It's horrible for function, So tons of studies on caffeine, but certainly not 2 hours or less before bed.
So those who are listening right now, they're like, dude, yeah, my wife tells me I snore. I've had these kind of events. What do you suggest that they do?
Well, the first step is talking to your doctor about it. We also have online, we have a sleep assessment. It's like 5 or 6 questions. We kind of get a baseline to say, okay, you're a candidate. These are the things that we think are likely that you may have it. And then to take a study. Tell me about how the study was for y'all. I mean, it's pretty easy.
It was easy for me. It took 5 minutes to set up, and I went to sleep. I know I woke up a couple of times in the middle of the night, but I looked at my Oura ring, and I was like, I wanted to compare to see how close it is. But I knew that I told you, I was like, my wife told me to. I was not sharp when I woke up, and that to me, does it say how many hours I slept?
Yeah, it talks about total sleep hours, but then it's all relative, right? So you got you got 6 hours and 38 minutes of sleep, right? So that's right in the sweet spot. For some people, that's too much.
I think that's too little.
Well, yeah, but that's how you've conditioned yourself to think, right? So again, it's relative. If you feel tired in the morning, there's a possibility you're sleeping through a cycle, and that's disruptive, right? Those times you're like, man, I woke up and I feel perfect.
Yeah.
Because you woke up at the right time, you got just the right amount of time of sleep. And there's other times where, like this morning, I woke up at 3:30, went back to sleep.
Messed you up,
and it kind of messes you up, right? And so when you're doing that, and you have to get up to pee so many times an hour, it really messes it up. But it's relative for you, and you got to find that sweet spot of when you go to bed and when you wake up. But routine is important, just like we teach our kids every night. They have a routine, and we try to slow everything down and get them calm and ready for bed. That's important, sleep hygiene. But I think for you, we got a little work to do. These two guys, it's easy. Therapy is easy.
We got to hit a break here. Tell everybody how they can get Heartstrong to help them out right now.
Yeah, heartstrong.sleep.com. Check it out. Take the sleep assessment. You can chat with us online. It's a text chat. If you have any questions, just chat. They may not get back to you right away, but it's a constant chat. It's not a live chat. It's a live person.
Thank you guys for
participating. Thank you a bunch. Yeah, it was awesome. Yeah.
Thank y'all.
Appreciate it.